So in this session, we'll continue with disorders of vitamin A. So deficiency is a condition observed when dietary daily requirement of any vitamin is not met. Okay, in that condition, it leads to deficiency, or in case of excessive consumption, that leads to toxicity. That means if you take more amount of vitamin than required, it sometimes it can lead to toxicity. It can turn toxic and have a bad effect on health. So let us see the conditions that are associated with deficiency of vitamin A before checking the toxicity elements. So one of the most common conditions we associate with deficiency of vitamin A is night blindness. Okay. So night blindness, it's a condition. It's the earliest symptom of vitamin A deficiency. Whenever there is vitamin deficiency, so the earliest thing that manifests itself, earliest symptom that manifests is night blindness. So it is a condition where the patient has difficulty to see in dim light conditions, like from evening up to night, where the patient has difficulty to see in those lighting conditions. If it is prolonged, if vitamin A deficiency is prolonged, this can cause irreversible damage to the retina. Okay, so if it is not treated and identified and treated in the early stage, it can cause irreversible damage. That means it can lead to complete blindness also. So the next condition that is associated is xerophthalmia. Okay, it is characterized by dryness in conjunctiva and cornea, and also keratinization. Okay, deposition of keratin in epithelial tissues. Okay, so what is xerophthalmia? It's a condition where we observe dryness in conjunctiva and cornea of the affected person's eye, and this also leads to keratinization. Now, within the conjunctiva, as this condition progresses, okay, it continues for a long period of time, the dryness leads to formation of something called as bitered spots. Okay, so bitered spots are rectangular plaques that that starts to manifest itself on the conjunctiva of the patient. Next is keratomalacia. It is a if xerophthalmia, let us consider a condition where xerophthalmia persists. Okay, it continues even after treatment, it is not getting reduced, it's still there. This leads to formation of ulcerations or ulcers within the cornea, and because of the ulceration, this leads to degeneration. So the cornea starts to break down physically. Okay, so that what happens with keratomalacia. Because of this, of over a prolonged time, can lead to complete blindness in the patient. So in severe conditions, vitamin A deficiency can lead to blindness. Okay, so all these deficiency conditions are associated with the role vitamin A plays in vision. We have night blindness, we have xerophthalmia, which if it persists can lead to keratomalacia. Right. Now we are also going to see how other functions of vitamin A gets affected, other areas gets affected because of deficiency of vitamin A in intake. So how does it affect on growth? Because of deficiency of vitamin A and its role which promotes growth, deficiency can cause retardation in the growth. Okay, so the growth can slow down due to impairment of skeletal tissue formation. Okay, addition of new bones, more muscles get affected because of vitamin A deficiency, and the growth of the person can retard. Effect on reproduction is adverse. So within males, this can lead to degeneration of germinal epithelium, which finally leads to sterility in males. Its effect on skin and epithelial tissue, skin starts to become rough and dry, and there will be formation of keratin. The deposition of keratin happens in epithelial tissue of gastrointestinal tract, urinary tract, and respiratory tract. Okay, so these are the deficiency conditions that we associate with vitamin A. Whenever we reduce its intake, then that is recommended. However, hypervitaminosis as a concept is very interesting. So if you we say that if you take too much in excess, anything in excess, it can lead to toxicity. So this is one of the examples of this. So hypervitaminosis is a condition where there is increased concentration of vitamin A within the body. So this is caused, as it is entering our body only through the diet, this can only be caused by excessive consumption. So whenever there is excessive consumption of vitamin A, this leads to toxicity, or vitamin A turns poison when we take more than that is required. So number one condition that is associated with hypervitaminosis is dermatitis. Okay, so my question to all of you is, what is dermatitis? Hepatomegaly, the liver becomes enlarged. Skeletal decalcification, we saw one of the functions of vitamin A was to maintain and increase the growth of skeletal tissue. Because of hypervitaminosis, the calcium starts to be removed from the skeletal tissue. The long bones, because of this decalcification, the long bones become tender, they become soft. There is loss of weight, hair loss, irritability, the skin will develop irritability. There is joint pain, can also be seen. Now, the thing with hypervitaminosis is, unlike the deficiency condition of vitamin A, hypervitaminosis does not have a particular symptom. So it is a group of symptoms that are spread in all the functional areas of vitamin A. Okay, so we see on skin there is dermatitis and irritability. There is loss of weight, skeletal decalcification, and tenderness of the bones when growth gets affected. The liver gets enlarged. There is joint pain, again related to the skeletal tissue. Okay, hair loss is there, again related to epithelium. So hypervitaminosis manifests itself as symptoms that are spread out. It is not very specific, unlike deficiency of vitamin A, where it is more specific. The first thing that we can see is night blindness, then development of xerophthalmia and keratomalacia. Right. So let us continue on to our next vitamin D. Like vitamin A, vitamin D is also fat soluble. They, in terms of structure, resemble sterols. Okay, they look like sterols and function like hormone. So if you repeat, whenever any sources or any plant-based vitamin D sources, it is called as ergocalciferol or vitamin D2 that comes from plants, and cholecalciferol or vitamin D3 that is available from animals. So any animal sources that we intake for vitamin D, we get vitamin D3, cholecalciferol. Any plant sources we intake, we get ergocalciferol or vitamin D2. So vitamin D2 and vitamin D3 are the vitamins of vitamin D. So what are the biochemical functions? Number one, the active form of vitamin D is called as calcitriol. The chemical name is 125 DHCC, dihydrocholecalciferol. That's the chemical name. The active form of vitamin D. Vitamin D functions within our body as calcitriol. It has different functions, different areas. Let us start with how it affects on intestine. Just like as we told, hormones will go and act or function on different, has an effect on different organ systems. Similarly here, calcitriol also functions as a hormone. It has some action on intestine. So on intestine, whenever it acts, it increases the absorption of calcium and phosphate that we have taken through the diet. So any food that is containing calcium phosphate, its as absorption will be increased by vitamin D. This is because of a calcium binding protein that will be produced or synthesized within the intestinal cell whenever there is action of vitamin D. So this increases the absorption of calcium and phosphate. So it's action on bones, okay, on osteoblast or the blast cells within the bone. So calcitriol will stimulate uptake of calcium. It increases the calcium uptake from by the bone from the blood, and deposits the calcium as calcium phosphate. Okay, this uptake of calcium is very important for bone formation. Okay, so just now let us see how it acts on kidney. It minimizes the excretion of calcium and phosphate by decreasing excretion and enhancing the reabsorption. Within the normal urinary process, calcium and phosphate will be filtered from the blood. It will be uh, going along with the urine. Now, because of the action of calcitriol on the kidneys, what they are going to do is they are going to decrease the amount of excretion. Whatever filtered from the glomerulus, it will start increasing the reabsorption of calcium and phosphate, thus reducing the excretion. Okay, so if you see, there is a theme here with its activity, how vitamin D works. It is always related to calcium and phosphate. Okay, so that is why it functions like a hormone. Always it's related to calcium. Number one, what does it do? It increases the retention of calcium within the body. Okay, it wants to retain calcium and phosphate. The activity of vitamin D can be summarized. The function can be summarized by its attempt to retain calcium and phosphate. How does it do it? Number one, by acting on the intestine and increasing the absorption of calcium and phosphate. Second, on the bones and increasing the calcification as calcium phosphate, and on kidney by reducing its excretion. So we see a theme here, a similarity of vitamin D function. Its role is, overall function is to retain calcium and phosphate in our body. So from where can we get vitamin D then? So fatty fish, fish liver oils, egg, yolk, etc. are good sources of vitamin D. Milk and milk products are poor sources of vitamin D. So whenever you are supposed to write in your examination, make sure that you don't write milk and milk products as sources of vitamin D. Milk and milk products are good sources of many things, but they are not good sources of vitamin D. However, there are three ways by which vitamin D can enter into our body. As you have told me two ways already. There are three ways of entry of vitamin D into our body. Number one, exposure to sunlight. This is very important for synthesis of vitamin D in our body. Second, through the diet by consumption of natural food containing vitamin D. And third one is irradiation of foods. Let me explain. So whenever we are talking about foods, they are irradiated. Some amount of radiation can also lead to synthesis or production of vitamin D within this food, such as yeast. If you irradiate yeast, which contain precursors of vitamin D, that can lead to formation of this or increased concentration of vitamin D within the food that we can take, and a process called as fortification of food by of milk, butter, etc. Fortification can also result in formation of vitamin D. So your work today is to go and find out, after this session is over, I want you to find out what is fortification of food. It's a very interesting concept. Please read about this on Google or Google. You can just check it out. You can search fortification of food. You'll come to know. So what is this process? Please read it and try to understand it. Okay, so we have seen functions. We have seen, let us see the deficiency. Now, deficiency of vitamin D is less common than toxicity. Okay, why? I will give you some reasons. Number one, the most common entryway of vitamin D into our body is sunlight. So we live in an area, or we live in a country where sunlight is there almost 8 to 9 months in a year. Okay, so for us, mainly the deficiency of vitamin D should not happen. Okay, it cannot happen. Why? Because the natural way of entry of vitamin D into our body is unlimited within India. So there is no issues at all with deficiency. However, we see people who are living in countries where there is less sunlight, such as Norway, Sweden, Finland, okay, in Scandinavian countries, in Iceland, etc. There the sunlight is very less, and very few days in a year there will be full summer. In some countries there is no summer at all. So in those people who are in those countries suffer mainly with deficiency of vitamin D. And one of the most common reason is if there is insufficient sunlight and malnutrition. Okay, we are not taking enough food with enough concentration of vitamin D. This can lead to deficiency. Okay, so deficiency of actual vitamin D leads to rickets in children and osteomalacia in adults. So what is rickets? Bone deformity is caused due to incomplete mineralization. So let me take you back to the functions of vitamin D. So one of the functions of vitamin D is calcification of bones. Okay, deposition of calcium within the bones as calcium phosphate. So that function gets affected due to deficiency of vitamin D. So bones become deformed because there is no completion of mineralization happening. So no deposition of calcium phosphate, no strength or the structural strength is given to the bones. Okay, this results in soft and pliable bones. That means the bones become soft and easily bendable. We can easily bend it. Okay, and also it affects the teeth, as calcium is very important. So teeth formation also gets affected. So this can be indirectly related to the absorption of calcium in the body. Okay, no matter how much you eat, if there is deficiency of vitamin D, calcium is not going to get absorbed. Okay, so any function related to calcium will also get affected due to deficiency of vitamin D. So weight bearing bones that are present, femur, tibia and fibula, all this becomes deformed. Okay, so weight bearing bones within the patient's body become bent and form bow legs, something called as bow legs. I want you to find out about bow legs also. So prolonged, it can cause osteomalacia, demineralization of bones occur, bones become softer. So this increases the susceptibility to fractures. Okay, so if something becomes softer, mainly with the bones, it can easily be fractured. It also causes a condition called as renal rickets. It's seen in chronic renal failure where kidney is also a location where calcitriol is synthesized. So mainly whenever the kidney function fails in chronic renal conditions, calcitriol synthesis also decreases within the kidney, and this leads to renal rickets. Okay, so again, let us go through the deficiency conditions because we expect some questions coming out from this area. So deficiency is less common. Insufficient sunlight and malnutrition results in deficiency of vitamin D. This causes rickets in children and osteomalacia in adults. So what is rickets? Bone deformity is caused due to incomplete mineralization of the bones. This results in bones becoming soft and pliable and also delaying teeth formation. So because of this condition, the weight bearing bones that are present in the lower limbs become bent and form bow legs. In adults, osteomalacia leads to the causes the bones to become softer and increasing the chances of developing fractures in them. Also, it causes a condition called renal rickets seen in chronic renal failure conditions due to decreased synthesis of calcitriol in the kidney. Right. So it's the last topic for us today: hypervitaminosis of D. Okay. So toxic effects of vitamin D includes bone resorption and increased calcium absorption, leading to a condition called as hypercalcemia. Hypercalcemia is a condition where increased calcium concentration in blood is seen. This is always related to mainly due to bone reabsorption or increased absorption of calcium in the intestine. So more vitamin D is present, so more calcium will be absorbed from our food, more calcium will be removed from the bones. Prolonged hypercalcemia is associated with deposition of calcium in many tissues, okay, soft tissues such as kidney and arteries, and it causes its own problems. In kidneys, it can cause kidney stones called renal calculi. High consumption is associated with the symptoms include loss of appetite, nausea, increased thirst, loss of weight, etc. Again, generalized symptoms as we saw with hypervitaminosis of vitamin A. So what we see here is vitamin deficiency is very specific. Okay, it specifically causes the organs where vitamin A is responsible for normal functioning. However, vitamin hypervitaminosis, whenever there is toxicity, they are manifesting as generalized symptoms. Okay, so that will be our takeaway from this session.